And thank you for joining the Justice Roundtable's briefing, Promoting Public Health and Public Safety During the COVID-19 Pandemic. This is our very first virtual congressional briefing, and we're so pleased by the response from all of you and so happy that you've joined us. My name is Gotsch, and I'm the Director of Strategic Initiatives at the Sentencing Project. My organization is one of over 100 national organizations that comprise the Justice Roundtable, and we work in coalition to reform federal criminal justice laws and policies. I'm very excited for today's event, and because we're joined by a stellar lineup of advocates and practitioners with firsthand knowledge of COVID-19 and its impact on incarcerated people and correctional staff. We'll open with words of wisdom and healing from Sister Helen Prejean, which are so necessary right now as the country mourns for lives lost from violence and illness. We rebuild and pursue peace and justice. Sister Helen will be followed by two panel discussions with experts moderated by myself and Kanya Bennett, who is Senior Legislative Counsel with the ACLU. Feel free to post questions in the Q&A box. And my Justice Roundtable colleagues will respond to your questions during the program as best they can. So I have the distinct honor of introducing someone I have long admired, Sister Helen Prejean. Sister Helen is known around the world for her tireless work against the death penalty and has been instrumental in sparking national dialogue on capital punishment and in shaping the Catholic Church's vigorous opposition to all executions. She is a native of Louisiana, and Sister Helen has served as a spiritual advisor for many people on death row, which inspired her to write Dead Man Walking, an eyewitness account of the death penalty in the United States. The book was made into a movie that is Academy Award-winning movie. It was made into a play and an opera. Sister Helen continues her work today, and she's also been vocal about unsafe conditions of confinement in her home state for all incarcerated people, and has closely monitored incidents at the federal Oakdale prison in Louisiana, which has experienced a high number of coronavirus infections among staff and incarcerated people, and resulted in 8 prisoner deaths. Welcome, Sister Helen. We look forward to hearing your opening remarks.
Sister Helen, you're muted.
Let us begin with a prayer. Put ourselves in the presence of our God that we believe is a God of compassion and fairness and justice, in whose image we are made, which sparks in us the desire for compassion and fairness and justice. We are in such an epic time. The suffering we simply cannot take in, of the number of people dying, just the hardship, 1 in every 4 Americans out of work, and something like 30 million people, since they're unemployed, losing their health insurance unless they quickly get back on in a complicated system. What a pandemic does is it open ends everything. It's like a volcano. All the systems go up in the air. We're affected on every level. Education's affected, employment's affected, and also prisons. And what we're discovering here is that we cannot just say to prisoners, we're going to lock you up and throw away the key, because we can't keep the virus out. We can't lock up a virus and throw away the key. And we have 420,000 correctional officers and staff going in and out of our prisons and jails every day. So we can't, as a public community, just say, we're inured to everything that goes on in those prisons. And when I first got involved with prisoners and with the death penalty, I didn't know anything about the criminal justice system. But right away, I began to understand there was a rhetoric, there was a way of looking at prisoners, that we began to really identify their character by an act in their lives. And it was probably one of the most dramatic social distancing things you can do, to say to another human being, look what you have done. That is who you are. We do not believe you can change. We're afraid that you're going to either get out of prison or kill us. And fear entered in, and that's how we even positioned ourselves to be able to say, so what we must do is terminate your life. That's how afraid we were made to be of prisoners. And now, with a pandemic upon us, and so the first cries I heard from the prison and from families were people in Oakdale. And we have a really strong social media, getting our voice out in the public square. And in fact, I just want to say to all the congressional staffers participating in this, the great importance of who you are and what role you serve in helping the communications between citizens and then our lawmakers, our congressional people who are going to set policies and help us. We're all in this together. And so it's us together with you. And we're really glad that you're giving yourself over to this, to listen today and to be a part of this. Respect your work greatly, pray for you. You're integral in the whole process of helping our community, our nation to change. One of the things that the pandemic is teaching us is that we are so interdependent. It's not the same way of it's all up to you. If you did it, it's on you. It's up to individuals. Pull yourself up. Local communities, pull yourself up. We are looking toward our national identity and our federal government and our Congress in a new way, because we can act individually. The threat is too great. COVID is everywhere. Hopefully, it's going to be in finishing, but we really don't have any hope of that. It could be that as we open up more, we're going to have a second wave. So it's going to be with us for a while. But as I got involved in the 80s, and I saw that the whole thing of the death penalty and imprisonment was just really got into the political currency, and people got elected to office by being tough on crime. Well, if you look back over the last 10, 15 years, there's been a movement away being tough on crime and being smart. And one of the ways we are made in the image of God, besides that spark in us to be able to feel the pain of others and have compassion, is intelligence, that we can come to truth. And we come to truth through community, not individuals sitting alone figuring it out, just like this, like we're doing today. We need to take a look at the whole penal system. I gradually came to understand. At first, I was just arguing for why we couldn't kill people and execute them, and then came to understand that life without parole is another kind of death sentence for people. And then when we look at this pattern of mass incarceration, of the long, long sentences, and as if we could absolutize a person in their crime and think we're going to enact that across the country and not realize that our weaknesses as a society, we're going to enter into this pattern. So are we surprised of the huge disproportionate number of people of color that are in prison? You know, are we surprised that so many of people that are in prison are poor and uneducated? Because our weaknesses are in there too. But now what this pandemic is doing, and I don't want to speak about it in too positive a way because the suffering's so great, but you just got to realize that when everything gets dislodged and thrown, we can look at it in a new way, and that's what's bringing us together today. The whole thing of public safety. It used to be, and you still hear this as a mentality, don't let those COVID people out of prison, they're going to infect us. And what we have to realize, where we have to be smart, is that 420,000 correctional officers and staff that flow in and out of prisons and jails every day come home to their families and their community. We cannot wall off, we cannot lock up the virus. We're all interconnected. And so now we have a chance to talk to each other and just to see, given our situation now, where's the call to new life? Where's the call to do things better? Where's the call to be able to practice both justice and compassion and safety for the community? And what's great about this is that it's not just a call to release people, compassionate release, but it's also that when people do get out of prison, that what is the release program and how will they be cared for? That's an integral part of the discussion. So thank you for letting me be here. I will accompany you in prayer all during this conference, and thank you so much for especially our staff for zoning in today to be part of this conversation.
Thank you so much, Sister Helen. We really appreciate you taking the time to be in community with us. This is a new kind of gathering. We've never done our advocacy quite this way before, but obviously these current times require it, and it's such a pleasure to have you join us. Thank you so much.
Glad to be a part of it.
Thank you. So we're going to now transition to a panel discussion that I'm going to moderate with Ashley Jackson and Amber Edmondson. So Ashley and Amber, if you could share your screens and unmute yourselves, please. Good afternoon. Thank you so much for joining us.
Good afternoon. Hey.
Hi. So I'm going to do some quick introductions of Ashley and Amber, and just a reminder for people who are watching this, you feel free to offer questions or comments in the chat or Q&A boxes, and my colleagues who are monitoring it, my coalition partners, will be happy to respond if you have any questions. So first I want to start by introducing Ashley. Ashley Jackson lives in Charlotte, North Carolina, and she's an actionist with We Got Us Now, which is an organization of children of people who are incarcerated. Her company, Gift Box Shop, helps incarcerated individuals stay connected to friends and family and loved ones through the act of gift giving. Ashley's father, Orrin Jackson, is currently serving a 98-year sentence in FCI Butner in North Carolina for a nonviolent drug-related offense. Next, we have Amber Edmondson. She lives in Louisville, Kentucky with her wife and 4 wonderful and talented kids. Through her own experiences with incarceration and overcoming a substance use disorder, she's found her voice to speak up for those who've been silenced or can't speak for themselves. Today, she'll speak on behalf of her brother, Jason, who is incarcerated at the Green River Prison in Kentucky. Thank you both for joining us today.
Thank you for having me.
You're welcome. So I wanted to start by, talking about how the coronavirus and this pandemic is affecting all of us, but particularly affecting your family. So we know the coronavirus has upended life for everybody in the United States. The consequences from COVID-19 and the seriousness of it are particularly affecting older people and people with chronic health conditions. We know from the CDC that to prevent infection and to help save lives, we all need to be social distancing. We need to be washing our hands regularly. We need to be using face masks. But what is that reality of prevention that is so critical, as according to the CDC? What is that reality like in prisons and jails? And so I want to ask you, in the conversations you've had with your father and your brother, how have those guidelines been implemented in the facilities that they're living in?
So Amber, I can start if that's okay with you.
Yeah.
So hi again, my name is Ashley. My father has been incarcerated for nearly my entire life. So for going on 31 years, it'll be this coming November. So I can speak to the realities at Butner, the federal prison here in North Carolina, where he's currently incarcerated. So just yesterday, another death has been reported. I believe at this point, 11 deaths at Butner. It's also important for me to point out that as of last month, Butner has had one of the largest outbreaks among our country's federal prison system. And so as we know, social distancing is not a reality for those in general population. So my father is in very close quarters with others serving time. And also right now, the BOP, which is the Bureau of Prisons, is on lockdown, meaning my father and other loved ones at Butner get 1 hour 3 times a week to come out of their cells. During this time, they're expected to take care of hygiene and communication needs. So to paint a more vivid picture for you all, this means that for 1 hour, they are standing in long, crowded lines to use showers, phones, and computers. And for the other 23 hours, they remain in very close quarters with cellmates who could potentially be infected. Now, regarding PPE, I know that my father does have access to face masks, but they don't have hand sanitizer. Unfortunately, hand sanitizer is still considered contraband in federal prison, considering the alcohol content. So just based on the conversations that I've been able to have with my father, that I've been able to visualize and paint for you all.
Ashley. Amber, do you want to talk about your brother's experience?
Yes. So my name is Amber. I'm from Louisville, Kentucky. My brother is currently serving a 6-year sentence at Green River Correctional Complex. Over 40% of the population there has been infected, tested positive for COVID. There has been no guidelines followed in this facility. I know that what's being spoke of is that they are, but they are not. They have all been giving masks. They're on a little over 23-hour lockdown. They don't even get an hour a day out. Every 3 to 4 days, they get about 15 minutes to get out, take a shower, check mail, make phone calls. Like I said, they were given masks. Laundry had not been done in the prison for over a month. My brother, actually, his cellmate was the last person who had passed away due to COVID in the prison. He had been infected. He had been sick for going on 2 weeks and ended up being the 3rd prisoner to die there due to COVID. There is no hand sanitizer. I know that we've been told, and our governor's leading conversations saying that in the prison itself, they're making sure that they're getting the supplies they need, the masks they need, the sanitizer, all of which are not true. My brother hasn't seen even hand soap. Nothing is being provided. They've been washing their clothes in sinks. And even when they decided to transfer inmates from, I guess they had came up with a plan, which was far too late, to transfer positives with positives and then negatives who were around positives to different dorms. There was no cleaning in between. So you basically just shuffled a bunch of inmates around areas that were still deemed that could be positive, like positive areas. No restrictions have been taken. The only thing that they have done is keep the inmates on lockdown and misinformed.
So Amber, are you concerned about your brother's health and safety in conditions like that?
I'm very concerned. My brother has underlying health issues, and he had just underwent bypass 15 months ago. And even though, you know, he actually found out through me, through a message through JPay, that he was positive for COVID. I'm concerned because, for one, I'm not a doctor. My mother got a phone call at 3 on a Sunday letting her know my brother was positive. And because we hadn't heard from him for days at a time, we ended up messaging him through an app called JPay, and was like, please give us a call. We need to know what's going on, how you're feeling. We heard you tested positive. That was his way of finding out he had tested positive for the coronavirus. We have since been told that they have retested everyone in the prison, which is not true. My brother has not been retested, still has not been retested. And my concern is that if there's nothing being done, I understand that my brother committed a crime. He committed drug crimes is what his charges were. And I understand that he committed a crime, and he did receive a 6-year sentence, but he did not receive a death sentence.
has there been any explanation from the prison where he's incarcerated? Like now that he's tested positive, what sort of actions are they taking and what is the medical treatment looking like?
There hasn't been any. They're not checking in on them. My mother did reach out and spoke to a deputy warden and delivered her a bunch of questions she had no answers for. So she then passed her on to another deputy warden who then told her they were understaffed. He said, we're understaffed. Their whole kitchen crew had walked out. So for over a month, they were receiving like sandwiches, 2 pieces of bread and a peanut butter packet, no hot meals. Nothing's changed. There's no temperatures being taken. They're not checking for signs or symptoms. I myself am an essential employee. So every day when I go to work, that's the first thing we do. We ask about symptoms, and we have a list that our governor has suggested that we, follow in order to stay open. And we do that. Unfortunately, in the prison, that is not what's happening. They're not checking on the inmates. They're not, every man who's in there or every woman who is in there in that system right now is just a number to them, not a person.
Ashley, what about you? You're muted right now. So I wanted to ask you, are you concerned about what's happening in your father's, condition and his likelihood of getting sick?
Yes, absolutely. And just to echo Amber's last statement, kind of hit me a little hard because I say this often. They're not just numbers in a broken prison system. These are people that belong to us. These are people that we love. So yes, I'm very concerned, just about my father's well-being. He's been incarcerated since I was 6 months old, but I've never had to worry about his safety and well-being the way that I do now. He's 51 years old. So of course, just given his age, I'm constantly concerned, just about the sanitary conditions at Butner's, the conditions at Butner. And also as a citizen, I'm deeply concerned because I feel that in a lot of ways, his civil liberties are being compromised. Being that they're on lockdown, my father has had an extremely difficult time staying in contact with his attorney, with his lawyer. So that has definitely presented a problem for us as well, outside of his overall health and well-being.
So what do you think can be done? Do you have what changes do you think Congress, you have staff on this call listening to your story. If you could, say what you think needs to change or how we could be more humane and thoughtful in our response to COVID-19 in prisons, what would you say is the right thing to do?
Yeah, absolutely. So we got us now collectively, we actually released a letter, which is on our website, and we released it to the Bureau of Prisons, local and state officials, also the media and communication companies. In this letter, we share our concerns as directly impacted sons and daughters in efforts to protect our parents behind bars during this devastating pandemic. So again, in the letter, we spell out our 4 demands. And the first, I would like to emphasize, is immediate clemency for our elders and the most vulnerable population to COVID-19. As far as our elders, we have the data to show that at a certain age, you age out of criminality. And, the costs actually doubles from $30,000 to $60,000 due to medical care. And so our other 3 demands focus more so on the health and safety of our loved ones behind bars. And again, those are spelled out in our open letter. So the second is free communications. As I stated, the BOP is currently on lockdown. So we have very, very, very limited communication with our parents and other loved ones. So we're asking that all federal, state, and local prison facilities, along with telecommunication companies, provide services to incarcerated individuals. And we ask that they supply families with free communications via phone, email, postage, and video conferencing services as a means to, mitigate the emotional trauma that a lot of us are facing resulting from the uncertainty of the health and well-being of our loved ones. And the third is a free mobile notification system coming from the BOP, the Bureau of Prisons, local jails and detention centers across the United States to alert and inform families about their COVID-19 pandemic response plan, prison lockdowns, visiting policies, and the healthcare services being provided to our loved ones during this time. And we're asking for that to be implemented by email and web announcements for those without smartphones. And then the last is safe and sanitary protective measures. So we're asking for aggressive, safe, and sanitary environmental protective measures to be taken now by federal, state, and local prison facilities across the nation to ensure that basic human needs of healthcare and survival for our loved ones are immediately met. Because again, they're not just numbers tied to a broken criminal justice system. These are people that we love. These are people that belong to us, and we are the families that they'll be coming home to, God willing.
Amber?
So, I want to say, like, Jason is my brother. Jason is his name, Jason Edmondson. He's also a son. He's a father. He's an uncle. He made a bad decision. And that bad decision, I've said it a million times, like, he did not receive a death sentence. He received a 6-year prison sentence. And I feel like with our justice system, like, we can do so much better. There are so many nonviolent offenders that have been sitting in prison for years. My heart breaks for you, Ashley, just after hearing you share for a moment, to know that somebody is sitting incarcerated for 31 years for drug offenses. I myself am a recovering addict, and I've had made bad decisions where I've ended up with a prison sentence. And thank goodness that I had like second chances to allow me the opportunity to today have a home and be a mother and be a friend and be a wife. And I'm doing things in my life today that are just, I found at one point in my life just purely impossible. And there's so many people that are incarcerated and are suffering and are going to die at the hands of, what we do know is that there isn't a vaccine right now, and we are coming into some of the unknown territory. And if we cannot make these people safe by like being more sanitary and providing the items that are needed, or loosening up and depopulating that population, by releasing the elderly, those with underlying health conditions. I mean, people who I always want to say, you've made a bad decision or a bad choice in life, just as a juvenile offender. Like, I really feel like it's time. My mom always tells me there's always hope. There's always hope. And so, like, today I hang on to the hope that at some point somebody's going to stand up and make a decision for the people who don't have a voice. So I'm grateful that I'm able today to like use my voice for the voiceless and to let them know. My niece lost her mother just a few months back, and then actually in February. And then I had to tell her not even 2 months later that her father was positive for corona in prison. And to watch the fear set in, and to know that nothing was being done. I made a decision that, like, at that moment in my life, like, I no longer just wanted to sit and listen. I want to use my voice and be heard. I think there are many things that we can do to loosen up the population. And I feel that it's inhumane and it's unjust to consider that we're just going to let them be. If we were flooding into the nursing homes when there was outbreaks, to depopulate those, like, these people are human just as well. Like, shouldn't we be depopulating and moving people around and taking care of those people as well?
Thank you so much, Amber. Thank you so much, Ashley. Your experiences are so vital for people to hear, because it informs policy, and those experiences, although they're painful, and we're so wishing the best for your families and for your loved ones who are incarcerated, sharing those experiences really do educate all of us, and in this case will educate the congressional staff who are on. So thank you so much for joining us and taking part in this briefing. It's really you've been really wonderful, and we are so thankful.
If I
Thank you.
Or if I could just add,
You are, Ashley.
there's a petition that corresponds with the We Got Us Now 4 demands. You can visit our website. It's wegotusnow.org. And to sign the petition and review our demands, it's change.org/protect our parents. So I just want to encourage everyone to, just support us in this work. That's a really easy, tangible way that you can really contribute to, the families that are suffering right now.
Thank you. So now I'm going to hand off the mic to my colleague, Kanya Bennett, who is going to be moderating our next panel. So if folks can now, on the next panel, share their screens and unmute yourself, we'll be ready to go.
Thank you, Kara. Good afternoon, everyone. Amber, Ashley, thank you so much for that humanizing discussion. Yes, you're exactly right. People who are incarcerated are so much more than numbers, and we appreciate you sharing your stories with us today to help us understand that. Thank you to the Hill staff and others who are still with us virtually to discuss how the Congress can promote public health and public safety during the COVID-19 pandemic. Again, I am Kanya Bennett, a senior legislative counsel with the American Civil Liberties Union, and I am based in Washington, D.C. I have the privilege of moderating this next discussion with professionals who are on the front lines of our response to COVID-19 in our country's jails and prisons. Over the next 20 minutes, we will hear from Dr. Homer Venters, a medical doctor and epidemiologist. He is the former chief medical officer of the New York City Correctional Health Services and the author of Life and Death in Rikers Island. We will also talk with Captain Nathan Neff, the jail administrator for the Black Hawk County, Iowa Sheriff's Office. Captain Neff is managing the COVID-19 response in the Black Hawk County Jail. And finally, we are joined by Melody Brannon, the federal public defender for the District of Kansas. Ms. Brannon has served her entire career providing indigent defense in Oklahoma, Texas, and now Kansas. As a reminder, you can raise questions in the chat where coalition partners will be monitoring and responding. We will also follow up with materials post-briefing. And with that, I would like to start this panel with a question for Dr. Venters. Dr. Venters, the Federal Bureau of Prisons reports more than 5,500 cases of COVID-19 among incarcerated persons and staff. 53 facilities, almost half of the 122 federal prisons, have confirmed active cases. 64 people in federal custody have died from COVID-19, and media reports indicate that at least one BOP staff person has died, though BOP refuses to include that death in its official count. Andrea Circle-Bear, a 30-year-old Native woman who gave birth on a ventilator just 1 month before she died, was the first federally incarcerated woman to die from COVID-19. There are House and Senate proposals that would require BOP to release to home confinement people particularly vulnerable to COVID-19, like Ms. Circle-Bear. Can you talk to us about why it is critical to reduce jail and prison populations by sending home or keeping at home those who are pregnant, those who have underlying health conditions, and those who are older and elderly?
Certainly. So thank you to everybody who's part of this. Thank you to the staffers and everybody who's listening and participating. So release is the first, but not the only step in the COVID-19 response behind bars. And I say first because we have to think of it as being critical to lots of objectives we all share, but release doesn't absolve us from the need to provide evidence-based, ethical, transparent services behind bars for everybody who's left. So release is critical because we know there are people who have a much higher risk of serious illness or death who are behind bars, and we generally know who they are. And so there has been actually quite a bit of movement in local county jurisdictions, some federal jurisdictions, and some, although fewer states, in their prison systems at getting people out who do not pose any safety risk, public safety risk. And in fact, the public safety risk is greater to have them behind bars, because I think it's important for us to consider that when a person dies behind bars, that is a threat to public safety. Their safety has been, impacted in the most serious way. They have died. And so it is important to get people who are at high risk identified and out to the greatest extent possible for their benefit. That also protects local hospital systems, which we saw, early on in Marion, Illinois. We've seen in other places more recently that when COVID-19 runs through like wildfire through a facility, it can overwhelm local hospitals very quickly, especially in rural settings that have fewer and fewer hospitals every year and more jails and prisons. But finally, and I say this having managed outbreaks behind bars, it's impossible to manage a large-scale outbreak when you're at 80 or 100 or 120% of capacity of the facility. So all of the steps that the CDC lays out that we should do, and in the 30 or so jurisdictions I'm investigating, probably fewer than half of them are actually doing these things. But setting up quarantine units for people who have been exposed to somebody who has COVID-19, setting up medical isolation that's not simply solitary confinement, that's actual care, all of that, creating housing areas to specially protect the high-risk folks who are still behind bars. All of that requires the space to move people around, to dedicate extra resources, to do the small amount of social distancing that we can try to implement behind bars. All of that requires space, and that space is not available if we don't unclutter and get home the highest risk folks. So it's incredibly important to not just the safety of the individuals, but to the welfare of the hospital system around the jurisdictions, and the ability of the administrators inside to manage the outbreak competently.
Thank you, Dr. Venters. And given your comments on the need for transparent services and some of the local county reduction you have seen, I want to raise this next question with Captain Nate Neff. So Captain Neff, on April 22nd, the ACLU released a model showing that COVID-19 could claim the lives of approximately 100,000 more people than current projections stipulate if jail populations are not dramatically and immediately reduced. The findings indicate that even if communities across the United States continue practicing social distancing and following public health guidance, the country will still experience much higher death rates if no substantial action is taken to reduce jail populations. There are House and Senate proposals that limit or incentivize the limitation of circumstances under which a person can be held pre-trial. Why should we reduce the pre-trial population in the wake of COVID-19? And is the ACLU jail modeling consistent with what you are seeing at the local level?
Thank you, Kanya. I'll kind of break that down into the two kind of questions there at the end. The first is why we should reduce our pretrial population. The people coming into jail are a high-risk population in general. I know we typically think of our nursing homes and the elderly and those type of places, but due to it either being health-related or just subpar living conditions, most of the population that we see coming into the jail is probably at a much higher risk anyway than the general public. Once you're in jail, it's nearly impossible for us to keep any kind of social distancing. We're doing the best we can. Thanks to a lower count, we do have the ability. We've been quarantining all of our new arrestees for 14 days upon coming in. That presents its own problems. The first, especially 2 to 3 days, but in that first 2 weeks especially, is the highest risk for any new inmate coming into a jail as far as suicidal ideations or anything like that. So it kind of reaches us to an elevated concern on those kind of things as well, because now those people are being kept in a cell for 23 hours a day and only coming out for an hour, and hopefully in that hour they can contact mom or dad or friends or family. So it kind of hurts us on two different levels there, and we're at a point now where with our counts, the number of quarantine, we're at a tipping point where it's hard for us to get all that quarantining done and those 23 hours a day. So it takes a toll on the staff and the inmates to try and get all that done. And people have it harder in jail anyway. And now it's becoming even that much more difficult for them here. So if we could get those people back out of jail as soon as possible, if there are alternatives upon arrest, that certainly helps us and it helps the inmates out. As far as the second part of your question with the jail modeling, from the ACLU jail modeling was, fortunately, we haven't really seen that here. With the cooperation of the courts, the county attorneys, the Department of Corrections, the defense attorneys, our numbers were down under half of what we typically are. So we've been able to take a lot of extra measures. We're screening every inmate that comes in, and we're screening our staff, taking temperatures as they come in and as they leave. So we've been able to keep that. We haven't had any inmates or of our own staff test positive yet for the COVID virus. However, we realize it's only a matter of time till it gets here. One case coming in could obviously lead to an outbreak within the facility. So the more people that we can keep out, the safer everyone in here is.
Thank you, Captain Neff. It sounds like other jails need to follow your lead then to reduce populations in order to prevent the spread of COVID-19. Definitely appreciate your reflection there. I want to now turn to Melody Brannon. Ms. Brannon, on March 27th, Congress passed the CARES Act, which authorized the Attorney General to expand the use of home confinement to release those in federal prison most vulnerable to COVID-19. On April 3rd, Attorney General Barr issued a memo to the Bureau of Prisons instructing the agency to move with dispatch in using home confinement and indicating that time is of the essence. Just a few days later, on April 6th, Attorney General Barr issued a memo to all U.S. attorneys advising them to consider a defendant's vulnerability to COVID-19 when litigating pretrial detention issues. Despite these directives on April 3rd and April 6th, however, BOP has used home confinement for just 2% of the 150,000 people, more than 150,000 people in its custody, and is actively opposing motions for pretrial release. Do you think that BOP and DOJ is using its authority to reduce jail and prison populations and protect the vulnerable? If not, how can Congress help?
No, BOP and DOJ are not using their authority. They have considerable unilateral discretion to do so. But specifically, for example, in pretrial release, our experience is that the prosecutors have opposed almost every motion and request we've made for our clients to be released. These are often people who haven't been to trial, they're presumed innocent. We went through when this began and identified about 23 clients, just 23, that we thought were the most compelling cases for release. The government released none of them and agreed to release none of them. We filed over 30 motions, formal motions before the court requesting release, and the government has opposed almost all of those as well. These are cases of elderly clients who are diabetic, a client who's in final stages of renal failure, and even after Andrea Circlebearer and that experience, they've opposed the release of a pregnant woman with underlying medical conditions and no criminal history. So that's our experience. The memo that you referenced that Attorney General Barr issued, while it did have some information or some language saying consider COVID in making your decisions, the balance of the memo was that you should proceed with business as usual. And that is exactly what has happened. Any message from Attorney General Barr to the line prosecutors to do something differently has fallen on deaf ears. We repeatedly hear the same argument in opposition to release, that there is no COVID in the jails and therefore there is no reason to release them. But the problem is they say there's no COVID in the jails when there's actually been no testing. And if there's no testing, there's no way to determine whether there's COVID in the jails. This is part of the ongoing problem we have with access to reliable data. To make a case for our clients' release, we have to have access to reliable data. And so not only has DOJ opposed release, they have obstructed our access to accurate data. When we have obtained, for example, subpoenas for data from the local jails and from where our clients are held, they have moved to quash those subpoenas. Even the local jails and county prosecutors have moved to quash subpoenas for accurate data in defense of federal pretrial detainees. You know, we want to know, if you're locked up in a county jail, how many people have been tested? How many people have come back positive? How many people are symptomatic and not tested? What is the capacity of the jail to manage that sort of crisis? That's the sort of data we need. And if there's something you asked if the Congress can do, standardizing the metrics for the data and giving us access to accurate data is just critical. The courts cannot make good, reliable determinations without that data as well. Without that data, we also have struggled to know how our clients are being cared for in the jails. We have clients who are symptomatic, who have requested COVID testing, and who have been consistently told, no, you cannot be tested. Until we have comprehensive, reliable, and repeat testing within the jails, we cannot really assess the risk and make determinations about how many people need to be released in order to preserve and protect public health. Part of the other problem, it's not just DOJ obstructing our access to data. Unlike some pretrial detainees who are actually in BOP custody, the marshals contract with local jails and private prisons to hold local detainees, but there's a very weak link between the marshals and those facilities. And so the facilities are not required to give this data to the marshals. I will say in my district, we happen to have a very good relationship with the marshals and with some of the facilities. So we have obtained some data voluntarily and informally, but that's not how it should work. There needs to be some standardization and accountability. Right now, the U.S. Marshal cannot tell you how many people in their custody have been tested, who are positive, how many have died, because there is no data tracking system. And so that's another thing that could be done, is sort of to standardize that and require that accountability of the marshals if they're going to place people in these local county jails to know what's going on. I think one of the earlier people mentioned the problems with our clients having access not only to testing, but to just basic things like hand soap. In my office, we actually took a collection and put money on our clients' books so that they could buy hand soap. It's kind of that dire. BOP has likewise not been forthcoming or transparent about the data that they provide about who's been tested positive and how that's worked out. There's not an obvious metric about how they report this information, and they have systematically underreported and misrepresented the data on their website. I know this particularly because the halfway house in Kansas had a recent outbreak, and we know from the local sources that the number of residents and the number of staff who tested positive, those numbers were underreported on the BOP website. And in fact, none of the staff who tested positive, those numbers never showed up on BOP. BOP and DOJ are unilaterally in control of this sort of information, and we need to be able to access that. The last point I'll make has to do with compassionate release. We have not been able to communicate with our clients reliably to get information for them. We call the prisons and the phone rings. It took me 32 days to get just a phone call placed with a client who was in a COVID-ridden prison at, I believe, Forest City. The compassionate release requirements right now, when BOP is not cooperating with us and don't respond, forcing us to go through the exhaustion remedies just takes so long. When we're dealing with a virus that can come in and kill someone within a week, we don't have 30 days and beyond that to go through all of the bureaucratic requirements. So that is something else that Congress could address.
Thank you, Ms. Brannon. And I plan to circle back to compassionate release in a few minutes. Given the many DOJ and BOP failings that you just pointed out in the response to COVID-19, I want to go back to Dr. Venters, who has inspected federal facilities like the Metropolitan Correctional Facility in New York City and found widespread and systemic failures to follow CDC guidelines and basic infection control practices. There, you found that BOP gave the court incorrect information about its compliance with CDC guidelines and its own guidelines. So I know you have said that measures need to go beyond reducing the federal prison population. So can we talk a little bit more about the steps that BOP should be taking to protect the health and safety of those who will remain incarcerated and to ensure that they have access to counsel, the courts, and programming? And what can Congress do to support these efforts?
Well, thanks. I think that what Melody was just talking about is critical, which is data. So the things I'm mentioning aren't unique to the BOP. As I said, I'm involved in, I don't know, probably over 30 jurisdictions, state, federal, ICE detention, county jails. One of the things that's a real problem if you care about health and public health is as soon as you go behind bars, it's a world of numerators. So all you ever hear about is a list of everything that was done, which is many of those things have virtue to them. But what you never hear, what you never see recorded or documented was what needed to be done. So for example, we will hear about how many people were tested and how many people had a positive test. What we don't know is how many people needed to be tested. So in jails and prisons right now, the way that gap exists is that we have a lack of adequate active and passive surveillance. And what I mean by that is active surveillance is going and looking for the problem, and that means screening. Most jails and prisons are just going around checking temperatures. They're not actually following CDC guidelines to ask people about their symptoms. That's what we do in healthcare settings. That's what we do for the staff who walk in the door. So that when you walk into a housing area and quickly scan 40 people's temperatures, many of them have symptoms right then, but they tell me over and over again, their cough, their sore throat, their weakness, their shortness of breath, doesn't matter, the person's only taking their temperature. That's the kind of practice that leads to the spread of this disease. But in all the settings I've looked at, you see that these checks, this active surveillance, isn't actually recorded in a way that the facility uses to track the spread of symptoms behind bars. So every facility needs to track and be able to report where are the symptoms, how many people have the symptoms. The other half of this, the passive surveillance, usually comes in through something called sick call, people signing up to get access to healthcare. Sick call systems in jails and prisons are almost uniformly broken. People repeatedly put in what's called a cop-out or a sick call request. They request care for a problem and they never get a response. And throughout the facilities I've looked at, you see people are writing down COVID symptoms and there's no response. That data is critical to knowing what's the prevalence of the problem. And only when we mandate that sick call requests and active surveillance, which includes symptoms, all of that data be retained and aggregated and reported out, only then can we have confidence about how many tests we needed to do if we're just testing based on symptoms. Now, many systems have moved well past this and are testing everybody, which I think is a smart move. We're gonna have to retest people. We're gonna have to think critically. Once we find people who are positive, what do we do to them? We can't simply throw them in a cell for 24 hours a day because all that does is disincentivize people from receiving care. So the CDC guidelines about what we need to do to care for people, not just lock them in a cell, we also can come up with performance metrics around this. So there are probably 20 metrics I can think of that we could measure easily to hold every facility to account. The final thing I'll say is that what we lack in this country is independent monitoring of healthcare and health outcomes behind bars. We have that throughout Europe. All the nations that have ratified the optional protocol of the Convention Against Torture have independent monitoring of these places. We don't in this country. So we've left it to jailers, to commissioners of correction and sheriffs to be the ones to decide what's the appropriate transparency and quality of health. And that's completely unacceptable.
Thank you, Dr. Venters. Captain Neff, let me have you jump in for a couple of minutes. As Dr. Venters noted, this failure to adhere to CDC guidelines is at all levels. It's not just BOP, ICE, U.S. Marshals, state, local, all of these facilities are struggling to respond properly to the outbreaks in their facilities. So I want you to share a little bit about why it's important that Congress make this investment at the state and local level. There are proposals in Congress that would authorize up to $1 billion in funding to address COVID-19 in prisons and jails. So can you talk a little bit about how that money would be used, why it's critical that localities be resourced in that way?
I think the big part of it is everything really starts at the local and the state level. Every inmate that ends up in federal prison at one time, he started off or she started off in a local jail or a local facility like that. You know, from the outside looking in, we're all kind of all these separate systems, but in reality, we're all part of one system, and we're only as strong as our weakest link. If we can't prevent, we can't test, we can't treat inmates on any one of those levels, it's going to end up circling its way back through. The U.S. Marshals are in my facility regularly, picking up inmates, dropping off inmates, and I know it's not a straight shot between here and the Federal Detention Center in Cedar Rapids. There's other inmates coming in contact. Like I said, we're only as strong as our weakest link. If we can't stop it on one level, it's going to spread throughout all the other levels anyway. So it needs to be taken care of from top to bottom.
Thank you, Captain Neff. And Ms. Brannon, let me come back to you on compassionate release. There are proposals in Congress as well that offer broad relief to those in federal custody by not only directing the release for certain vulnerable populations, but they also limit pretrial detention, as well as the use of incarceration for supervision violations. So Congress could equip courts to more easily help the vulnerable through slight adjustments, easy fixes to existing federal statutes governing, as we were going to explore, compassionate release, as well as elderly home confinement. Can you talk a bit about that?
Yes, and you're absolutely right. We need clear and simple solutions during this pandemic. And the first thing they could do for compassionate release is just to suspend the requirements to either wait or exhaust before bringing a matter to the court. Just suspend it while we're in pandemics and emergency situations like that. That's an easy fix, and it will make a huge difference in who is released and the court's authority to act. Secondly, they could expand the tools available to the court and give the court more authority to release by doing things like expanding the people who would be eligible under the elderly offender program, lower the age of eligibility, lower the time that they have to serve before qualifying for this. That would give the court more tools to consider cases and make the right decisions.
Thank you so much, Ms. Brannon. And so we have just a few minutes left, probably just enough time to close out this panel. We want to be mindful of everyone's time, recognize that everyone is being pulled in so many different directions, as Kara noted at the start of this, responding not only to death and illness in our facilities, but also in our communities, those lives that have been touched by police violence. I know a lot of us are focused on right now. So want to really appreciate the time that people have taken to be with us today, and want to thank, of course, all of the panelists that we have heard from today. Sister Prejean, thank you. Ashley, Amber, thank you. Ms. Brannon, Captain Neff, and Dr. Venters, we appreciate you for sharing your time and expertise with us today. We, again, will be following up after this briefing. So some of the materials that were shared in the chat and others will be circulated to those of you who have joined. And I would also like to thank the organizations that planned this briefing. These briefings do not happen because of one or two organizations. They happen because many of us come together in coalition to advance these priorities. So I want to lift up the American Bar Association, the American Civil Liberties Union, the Campaign for the Fair Sentencing of Youth, the Center for Disability Rights, Church of Scientology, Drug Policy Alliance, Federal Public and Community Defenders, Justice Strategies, Innocence Project, the Leadership Conference on Civil and Human Rights, Religious Action Center for Reform Judaism, National Association of Criminal Defense Lawyers, National Association of Social Workers, National Council of Churches, and the Sentencing Project. So many organizations it takes to do this work. So thank you to our partners. Again, thank you to our panelists. And thank you for those of you on the Hill and elsewhere who have joined to talk today about how we can make sure that we address the COVID-19 pandemic as it impacts our nation's jails and prisons and our communities. Thank you.